Okay, so if you have read and understood, considering 8 critical care scenario, kindly please begin and tell me, after reading the scenario, how would you manage this patient?
I will manage the patient according to ETLS protocol,
Yes.
and I will go for ABC approach.
Okay.
Along with the ABC approach, I will do simultaneous resuscitation as well. And for the airway, I will first check the airway is patent or not, and I will do cervical spine immobilization as a patient is a trauma patient,
Yes.
and then I will check the breathing. If there is any chest injury present or not, and I will do accordingly. I will manage the patient accordingly. And for C, I will check patient's pulse, blood pressure, urine output, and I will open to wide bore channel and start crystalloid fluid, and I will send blood samples for necessary investigations, and I will
Considering, yes, considering this is a,
considering the
yes, RTA
yes, ma'am.
patient.
Considering the given scenario,
Yes.
I will check any external hemorrhage present or not, and I will stop that. Try to stop that by as patient has crushed right leg. I will immobilize the, patient's right leg and elevate it to stop any external hemorrhage.
Okay.
And I will also give a pressure bandage as well, and I will check if there is any signs and symptoms of compartment syndrome present or not.
Yes.
And after doing the primary survey and adjuncts of primary survey, I will I will check the right patient's right leg in details, and as patient has high colored urine as well, and patient
Yes.
is unconscious, I will suspect for any crash injury, and it may lead to rhabdomyolysis as well, as a patient has blood in urine dipstick test, and also raised urea creatinine and raised potassium level. In that case, I will first, after stabilizing
Okay.
patient's hemodynamic status, I will go for, I will resuscitate the patient. I will hydrate the patient to maintain urine output more than 300 ml per hour, and until the urine color, myoglobinuria is decreased a bit. Mm, and I will continue
Okay.
patient
You said,
management with
yes,
diuretic. Yes, ma'am.
you said myoglobinuria. What is myoglobin?
Myoglobin is the oxygen carrying protein present in muscle.
Okay. What is myoglobinuria?
Myoglobinuria is a condition when muscle cells are injured. The toxic materials of muscle cells are released into systemic circulation, and that causes myoglobinuria.
Is it normal to have myoglobinuria?
No, ma'am, it's not normal. When muscle cells are injured, it happens, and it ultimately precipitates in the renal tubules.
Okay. So if a patient like this patient already presents with high amount of urea creatinine and raised potassium levels, what would you keep in your mind? And according to you, patient is already undergoing myoglobinuria. So what would you keep in your mind while managing this patient?
A patient may have developed acute kidney injury, AKI.
Very good. So how would you manage? How would you take care of renal functions of the patient?
I will ensure the patient is well hydrated, and I
Yes.
will maintain urine output more than 300 ml per hour.
Yes.
And I will give diuretic. I can give mannitol to increase urine output, and to alkaline for alkalinization of urine, I will give sodium bicarb. And as patient has raised potassium, I will manage that hyperkalemia as well. And
Can you name
um,
few
uh,
causes of myoglobinuria other than trauma?
yes, ma'am. Blunt trauma is the cause which is
Yes.
present here, and some other causes are like if patient has massive burn,
Good.
if in case of hypothermia or hyperthermia
Good.
or prolonged immobilization, and also some certain drugs also cause myoglobinuria, like statins, fibrates, alcohol, and strenuous exercises,
Good.
prolonged
Okay.
exercise.
Can you please tell me, you did mention that you'll rule out if patient is undergoing compartment syndrome. Can you tell me what are the clinical features that you'll observe?
Yes, ma'am. Clinical features like a patient may have increasing pain out of proportion to the level of injury, and a patient may have pain on passive stretching.
Yes.
A patient will have pulselessness, pallor, and paresthesia, though these are late signs.
Okay. Can you tell me how frequently would you do the lab for this patient? How frequently
Um,
would you be asking for the lab to follow up the patient?
I will first I will do hourly. I will check hourly ABG,
Okay.
and
And
then serum creatinine, creatinine kinase. This will be followed up.
okay. Which drugs can you suggest to take care of patients' ongoing renal injury?
Which drug? I will give mannitol.
Yes,
Uh,
for
and
diuresis. Yes, and
yes, ma'am, and sodium bicarb
yes,
for
good.
urinary alkalization.
And
And
how would you
I will
manage hyperkalemia?
to manage hyperkalemia, I can give salbutamol
Yes,
via nebulization. I can give calcium bicarbonate,
yes,
and okay, sorry, ma'am, calcium gluconate,
yes.
and
And
I will give uh, calcium. Mm,
in this case, what kind of
I can give insulin, ma'am. Sorry, ma'am, I forgot.
insulin in
Short-acting
COVID?
insulin.
Okay. In this scenario, what type of fluid would be best to give as a maintenance fluid?
As a maintenance fluid, Hartmann
Okay.
solution, distillate fluid
Okay.
is essential.
Okay. Why not crystalloids? Which crystalloid can you give?
Hartmann solution.
Okay. Uh, how else can you manage, or if you fail to manage hyperkalemia, what is the last resort that you can do?
Last resort is
Dialysis hemofiltration.
renal replacement therapy.
Yeah. Good. Thank you.